you. Good afternoon, everybody. So I am Semi Wanet from the University Hospital of Lausanne, Switzerland, and I'm pleased to give you an overview of the results of our study about cortisol, life events, and cognition in non-demented subjects. So first of all, I have no conflicts of interest to declare. You all know that life events are highly common among the elderly. Stressful life events have been shown to activate the HPA axis, thus resulting in increased cortisol output. Many studies highlighted that high cortisol levels are associated with impaired cognition. Other studies linked stressful life events to cognitive impairment. It has thus commonly been assumed that life events might impair cognition through the activation of the HPA axis, that means through increased cortisol levels. However, very few studies actually examine those links between cortisol, cognition, and life events, and that was the aim of our study. So we carried out a cross-sectional analysis using data from the Colau-Saint-Colaus population-based study involving 6,733 residents from Lausanne city in Switzerland. So we had a sample of 796 individuals aged at least 65 who were consenting and non-demented. In those patients, we first performed a thorough neuropsychological assessment in order to determine the main outcome, which is the CDR, the Clinical Dementia Rating Scale, sum of boxes, a widely used measure for global cognitive performance and its functional impact. We also measured we had four salivary cortisol measures, and we calculated the cortisol area under the curve, a widely used and validated measure to describe the daily cortisol profile. And then we also assessed life events as well as their total impact through a questionnaire. So what were our results? So first of all, we found a positive association between the CDR sum of boxes and the cortisol area under the curve. That's to say, in other words, that higher cortisol levels were associated with poorer cognitive performance. So this result is in fact consistent with most previous studies, which showed that higher levels of cortisol might be associated with poorer cognition in individuals without dementia, but also with a more rapid cognitive decline in patients with Alzheimer, mild cognitive impairment, or dementia. Yet, other studies found opposite results with higher cortisol associated with less rapid cognitive decline among patients with mild cognitive impairment. So why this discrepancy? Well, certainly because of different designs, but also and above all, probably because of different effects of cortisol depending on its levels in the brain. So we often describe the effects of cortisol on cognition as an inverted U plot. That means that mildly elevated cortisol might enhance cognition through the activation of mineralocorticoid receptors, whereas higher levels of cortisol might impair cognition through the activation of glucocorticoid receptors. Now, what about the link between life events and cognition? Well, we found no association in our study between the CDR sum of boxes and the life events total impact. Results of similar studies have been conflicting. In fact, while some studies reported that stressful events might be associated with poorer cognition and increased risk of late life dementia, others failed to replicate this finding, and some even reported a possibly enhanced cognition following some stressful events. Now, what about our hypothesis? Do life events really explain or modify the link between cortisol and cognition. So here you have the partial regression scatter plots for the association between the CDR sum of boxes, the cognitive performance in other words, and the cortisol area under the curve, before and then after controlling for life events. And as you can see here, the graphs are very, very similar, which indicates that life events in our study did not explain or modify the link between CDR sum of boxes, between global cognition and cortisol. Well, how can we explain then this link between cognition and cortisol? There are many other possible explanations for this. First of all, we often think that higher cortisol might impair cognition, but maybe we may think about the same association the other way around. That means that we know that the hippocampus inhibits the HPA axis. So hippocampal atrophy, for instance due to Alzheimer's disease, might uninhibit the HPA axis, thus resulting in increased cortisol levels. Another explanation is that the actual effects of a stressful event on the HPA axis is not always explained, or that it does not always bring about an increase in cortisol. And the effects might be variable depending on the nature of the stressor, the time elapsed since the stressor, its controllability, the core emotions it is likely to elicit, as well as the psychiatric sequelae. And then we often think that cortisol is a stress hormone, which is certainly true. But cortisol is also a metabolic hormone, playing a major role in metabolism, in the metabolic syndrome, and which is associated with both vascular dementia, but also with Alzheimer's disease. So to sum up, we can say that we found a negative association between cortisol and global cognitive performance. Life events did not seem to explain this link between cortisol and cognition, and then longitudinal follow-up of the cohort will help to better understand the dynamics of the interrelationships between life events, cortisol, and cognition. And thank you for your attention.
Excellent presentation. Any questions? Yes, please.
Did you use geriatric depression scale in your study?
Depressive scale?
Geriatric
Yeah, certainly.
depression scale.
We controlled for depressive symptoms. We controlled for a number of variables, social demographic variables, so age, gender, educational level, depressive symptoms, and then also we controlled for the body mass index, which can be associated with both cognition and cortisol. So we controlled for that.
There was another question?
What was the time between life events reported here and the actual study? Was it also 10 years ago or just the last year? Or was it?
In fact, the questionnaire we used refers to all kinds of life events throughout the lifetime. So, but the patient should, or the individual should rate the impact of each life event, the current impact of each life event. Of course, subjectively, but we don't have any other means to do it so far.
Thank you very much. May I ask the next speaker, please?